have you ever stopped and wondered why some people seem to live these long, healthy lives, while others, maybe just a few streets away, really struggle with their health? The answer is so much bigger than just doctors and medicine. So today, we're going to pull back the curtain on this invisible system that shapes our health every single day. We're asking the big question, what is public health?
Isn't it a bit strange? हम सब अपनी हेल्थ के बारे में तभी सोचते हैं जब हम बीमार पड़ते हैं. It's like we just take our well-being for granted, right up until the moment it's gone. But what if the whole goal wasn't just about treating sickness after it happens, but about stopping it from ever happening in the first place?
Okay, to really get this, let's use a simple example. A doctor treats one person's broken leg. Super important, right? Their focus is on that individual, and the goal is treatment. That's what we call clinical medicine. But a public health professional, well, they take a step back and ask a different question. They ask, wait a minute, why are so many people breaking their legs on this specific road? Is the pavement all cracked? Is it too dark at night? See the difference? Their focus is on the entire community, and the goal, well, it's prevention. It's about seeing the whole forest, not just a single tree.
And this idea has this really powerful, century-old definition from a guy named C.E.A. Winslow. He called public health a science and art, which is beautiful, but the words that really matter are right at the end, through the organized efforts of society. This tells us it isn't just about individual doctors, it's about what we all build together as a community to make sure everyone has a fair chance to be healthy.
So if our health isn't just decided inside a clinic's four walls, then what are the real causes? What are these invisible forces that are shaping our well-being long before we even start to feel sick? Well, turns out the answers are often found not in a hospital, but in the world right outside our front door.
I want you to think about your own city for a second. Why is it that people in one area often live longer, healthier lives than people who are just a few kilometers down the road? I promise you it's not a coincidence. There are these incredibly powerful and often unseen forces at play that literally determine our opportunities for good health.
These forces have a name. They're called the social determinants of health. And I absolutely love this phrase you're about to hear. Think of them as the causes of the causes. They are the conditions where we're born, where we live, work, and grow older. Things like our access to good schools, our financial stability, the safety of our neighborhood. You see, these are the very foundations upon which our health is either built or sometimes broken. Now, these determinants are usually grouped into 5 key areas. You've got economic stability, having a secure job. Then there's quality education, which opens up so many doors. Of course, access to healthcare, being able to get help when you need it. Your neighborhood itself, like having safe parks to walk in and clean air to breathe. And finally, your social community, that support system that we all rely on. Every single one is a critical building block for a healthy life.
Okay, so if our health is shaped by everything from our roads to our schools, a problem this huge can't possibly be solved by the health department working all by itself. No way. It needs a much, much smarter approach, one that really thinks outside the traditional boxes.
And that approach is called health in all policies. It's actually a pretty simple but totally revolutionary idea. It means that every government department, whether it's transport, housing, or education, has to think about how its decisions are going to impact people's health. So the goal isn't just, let's build a road. The goal becomes, how can this road also make people healthier?
Here's a perfect example of what we call intersectoral collaboration. It's when the transport department and the health department stop working in their separate silos and actually start talking to each other. When they collaborate, they can achieve something so much bigger. They can design streets with better footpaths and dedicated cycle lanes. And what does that do? Well, it doesn't just reduce accidents, it also encourages people to get out, walk, and stay active. It's a total win-win.
And listen, this isn't just some hopeful idea. It's a real practical strategy. It all starts by finding a shared goal. Then you get everyone to the table. Housing, education, transport, and, this is the most important part, you actually listen to the community itself. What you get in the end isn't just a temporary fix. It's lasting, structural change that builds a healthier society by design, not by accident.
So, who are the people actually doing this incredible work? Well, it's not just one type of professional. Public health is a massive team effort, full of what I like to call health guardians.
You have epidemiologists. They're basically disease detectives, tracking outbreaks and figuring out what's causing them. Then you have health educators who create campaigns to help us all build healthy habits. There are health policy experts who work with the government to create laws that protect our collective health. And of course, environmental health specialists who make sure our basic needs like clean air and safe water are always met. It's this huge, diverse team, all working with a single focus, the health of the entire community.
And that brings us to what might be the most important point of all, the incredible, real-world impact of this collective work, and the role that every single one of us plays in it. So what's the real impact of all this? Get ready for this statistic, because it is absolutely mind-blowing. In the 20th century, the average life expectancy shot up by 30 years. 30 years! But here's the wild part. Of those 30 years, a full 25 of them, 25, didn't come from some miracle cure or fancy new surgery. They came from public health. Simple things like clean water, vaccines, safer roads, and better sanitation. That right there is the staggering power of prevention. The Institute of Medicine once described the role of public health as serving us all as our village. And that idea, it just resonates so deeply with us here in India, doesn't it? This concept of community, of looking out for one another, that's the very soul of public health. It's the promise that there are systems in place so that everyone can have a chance to be healthy. So I'll just leave you with this one final thought. Our health is never, ever just our own. It's connected to our family, our neighbors, our entire community. The air we all breathe, the water we all drink, the safety of our shared streets, it connects us. So the final question really isn't for me, it's for you. What is your role in building a healthier village for us all?